Hi, I'm Dr. Sebastian Gonzalez, and today I'm going to talk to you about pinched nerves. One of the main reasons I want to do this video is because I do see a lot of misinformation out there about pinched nerves. Patients and patients' friends in particular, a lot of times they'll call up talking about how they have a pinched nerve in their neck or in their lower back. And I start talking to them, and eventually I hear that actually they've been self-diagnosing, and I feel they need a little more education on what a pinched nerve actually is. So this video today you're going to learn about that, but also I don't want to misconstrue this as a tool for self-diagnosis. By no means, if you have some type of pain or ailment, should you self-diagnose in any manner. You definitely need an examination by a qualified medical provider to be able to find out what's going on with you and how to care for your type of condition. So when I think of nerve entrapments, oftentimes I think of very sharp stabbing pain, a lot of times in the extremities such as the arms or legs with quick motions. For the sake of keeping things easier, we're going to talk about the upper body today. So these people, if they have a nerve entrapment in the upper body, it's mostly going to go down to the arm. So a lot of times they'll have guarded motion as well, so they can't turn their neck and they're very guarded, and they end up moving their shoulders before they move their head because they're trying to protect themselves. So the most common symptom pattern I see in my office is going to be out into the neck, back down to the shoulder and into the tricep, out into the back part of the forearm, so not this side but this side, and back into the hand. A lot of times it's associated with numbness of the fingers on the back side. It's very often confused with carpal tunnel syndrome. If you really understand how this type of condition starts and what causes it, it's very easy to treat. So a lot of other healthcare providers think these the symptoms we're talking about are actually from spinal involvement. They talk about how, and actually this is looking from the front, this is looking from the back, and these are all these little nerves that come out all the way down into the lumbar spine. So they seem to think that there's an impingement on these nerves by either the bony projections coming out of the spine itself here, either from arthritis, osteoarthritis, same thing really, but they come out and they actually touch on the nerve and they cause symptoms. Another way that it's a common thought is that they have these discs all along the spine here as well. Is they protrude out for whatever reason. They can also impinge onto these nerve roots as well, and that's very common, and it can happen. But you know, a lot of times these are surgical cases. Sometimes they are, sometimes they're not. But a lot of times what I see in my office is even if people have some of these findings on X-rays and MRIs, they can be fixed. The reason being is because a lot of times these nerves actually they actually come out of the spine a little further, and there's actually muscles here that attach onto the spine. The most common spot that I see that they're entrapped is called the anterior medial scalenes, which is actually, if you look at it on me, it's gonna be right here. So these muscles, they're very small and fine, and if you're looking at it like this, so here's the anterior medial scalene muscles. The nerves, all the nerves that go out into the arm actually go through these muscles. So if you can imagine, if these things are tight and fibrous for whatever reason, a lot of times overuse injury, acute trauma, they go into spasm and they pinch down on these on the nerves. So what happens here is you eventually strangulate all the nerves that are going out into your arm, especially the one we're talking about that goes down the back of the forearm. So a lot of times freeing up this nerve from this spot, as well as all the other common entrapment sites along the forearm, definitely takes care of this condition. So usually the first line of care people try is home care. They try resting it, heating it, icing it, and restriction of motion, aggravating motions, and all this is good. And a lot of times it'll take care of very acute cases. So the fact of the matter is, a lot of times their condition is kind of beyond that, and they live with it for about a month or so. Then they realize, hey, this thing isn't going away. Maybe I should get someone to look at it. The thing that I found is actually the most effective is called active release technique, or ART. Because a lot of times this is a soft tissue problem, and there's those muscles sticking to the nerve between those two structures, and anywhere along down to the arm as well. ART basically goes in there specifically finding the spots where there's those restrictions and the nerve is entrapped, and it breaks them up. So it lets the nerve slide, and it's not basically pinching off anymore. ART usually helps these types of conditions within about 4 treatments or so, and at that point you should feel that you're feeling a lot better. You might not be completely resolved at that point, but a lot of times it's definitely a change you can feel, and you're very happy that you tried ART at that point. ART is not something that a lot of people have heard about, and I actually have no idea why. It's just not mainstream yet, but it is very popular in professional sports. It's actually the official soft tissue treatment of Ironman triathlons, so that kind of tells you something about its validity right there. It's used with pro NHL players, NFL, NBA, Olympic athletes. A lot of MMA fighters also use it as well. So it is very valid, and it works a lot, especially for these types of individuals who push their bodies to the limit. But I can't stress enough, it's not only for sports injuries, it's for everybody. This treatment is definitely for everybody. I can honestly say the reason I got into this was because I had a back injury in high school playing baseball, and I was supposed to have a back surgery, and someone did active release on me in '96, and it helps. I mean, I don't need a surgery anymore, and it's been over 10 years, and it's worked for every type of injury that I've had so far. I had a neck issue, shoulder issue, lateral knee pain, so all this type of stuff goes along with training a lot, which is what I like doing, but it's definitely the most effective thing that I've seen for these types of injuries. So if you have more questions about active release, please visit the website.
Don't forget to check out our ebook at the website below.